All right, so now we have the wound packed, and I'm going to put on this. It's called dimethicone protectant. It's what they recommended in the hospital. He was in the hospital for 8 weeks, and someone else did this until they taught me how. Okay, I put this on. It's so that when the secretions from this are up against the skin, it protects the skin from those secretions. All right, so we put that on each time. Okay, now these don't have to. These are just the regular 4x4 gauze pads. I'm going to put a few of these on here. Like this. So you see we already have, this is actually the second layer for absorption that we've done. We did the packing, and now we're doing this. Now, oh, I have to get some more gauze.
Okay. So, Dad, since we have a little break, do you sometimes nap during this procedure?
Never.
All right. Now, this is the gauze that I use. And as I told you earlier, initially when we did this, it took about a half roll of this gauze to pack the wound. I did that instead of using the 4x4 pads that I used. It took about a half a roll of this to put down in there. So it has really improved since then. All right, now I just eye this to see how much I need. And we're going to fold it in half and put it right again in that trough. You remember, you want to see the trough there? That has come from scarring, really. He's had a lot done to this back. This was where he had his first lobectomy in 2002. All right, so we make that extra thick right there in the trough. And now spread it across the entire wound. Okay, now I like to take a small piece of this kind tape, which we found that this is the very best thing to use. It costs more, but it doesn't cause him so much discomfort as the other, when we take it off, as the other adhesive tapes do, or surgical tapes. I think it's 3M kind tape. All right, so I put that on there to secure the bandages that we've done so far. So now we have quite a few layers of absorbent gauze. And we're going to put on another one. Oops, I dropped one. Won't be using that. Now we put on some more gauze pads. Okay, then we're going to use, this is a skin coat, and it's a protectant again. It helps the adhesive stay better, and it also protects his skin, because you can imagine that having this much adhesive on your skin, having it changed every day, going on now to a year, but you can see his skin looks really good around there. He doesn't have any problems, I think, because we've been so careful and diligent about taking care of that skin. We want to make it as painless as possible. Okay, now for the final layer. This is a 5x9 ABD pad, a 5x9 ABD pad. At one time we used the bigger one, the 8x10, but now we've gotten down to this. All right. And once again, I figured out through trial and error the best way to do this. I attach it on one side first. I use the heat of my hand to be sure that it's on there well. This is a difficult place to get, you can sit up now, Jim, to get the bandage to stay, because it goes around his side and he has that place in there that's inclined to gape over here. All right. I'm going to pull this tight. Again. Okay, I do this side last. That's the side that's usually the most troublesome. And one reason I want to do this is because for any of you that have to change a wound regularly at home, I want you to know that it takes time, but it can be done, and it's not anything that you need to be afraid of tackling. I think the only problem is that I'm sort of attached to Jim by a ball and chain, because he can't go any place without me for a few days. Because no one else can do this. Nor can I go off and leave him. But I'm not going to do that anyway. So. Okay. Voila.
Thank you.
We're finished.
Yay, turn around and smile, Dad.